Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And welcome back. As we mentioned prior to the commercial break, we are being joined now by Dr. Jorge Hidalgo. He's an internist and he has extensive knowledge on what is currently taking place regarding COVID-19. Good morning, Dr. Hidalgo.
Good morning, and thank you to having me again.
So, where do you want us to begin from? Because we're looking now at 15 deaths, we're looking at 945 active cases, and we're looking at over 1,000 cases of COVID-19 in the country since the beginning. Let's get your take on that first as a starting point, and then we can begin to expand our conversation from there.
Yes, well, as we've essentially been saying over and over, COVID-19 is a learning process for all of us. And despite of that, we already have a little bit more knowledge of the condition, we are still learning a lot. And of course, as everybody knows already, COVID-19 essentially is a test to all the health systems in the world. Unfortunately, even the most strongest health system in the world shows how fragile we are as a human beings when tense and we're facing a situation and a disease that is unpredictable like the SARS-CoV-2. I mean that what we're seeing in terms of numbers and is a reflection of what is happening in the world. No? We know that 80% of the population is going to exhibit mild or no symptoms. We know that more or less 5 to 10% of the cases, up to 15% of the cases are going to present just with a mild to moderate condition. And we know that 5% of the patients are going to end in the ICU critically ill. And from those, we know already that probably one of three patients probably we're going to lose those patients despite of all the efforts we can make. No? That and this basically depends on many factors. Depends on the medical background of the patient. It's going to depend on how your body is going to respond to the aggression of the virus. And that is an important to mention because at the very beginning of the pandemic, if you guys remember, we say, okay, this is a condition that affects only the elderly population. However, down the road, and what we are seeing is that anyone can be affected. And even if there are 5 people from different ages, probably one is going to get it really badly, and it's not going to depend on it basically depends how your body immune system is going to respond to the aggression of the virus. No? I mean that there are many factors that we are seeing and we are learning every day. Also, we knew at the beginning we thought that probably the children are not affected, and we are seeing also an increased number on pediatric patients affected for the virus. A great number of people in the 30s, 40s that also are being affected. I mean, the virus is basically behaves in a way that we still not completely understand.
Yeah. What I found interesting, Doc, is that, again, this is during the Ask the Expert segment on Friday, where the Director of Health Services was essentially saying, look, you have contracted COVID-19. In some cases, you will get better within a certain period of time. In other cases, it will take longer for you to recover from it, depending on, you know, your body. He's saying, look, some people they may be dealing with this thing for several months after they've contracted it, while they have since tested negative and are written off as having recovered. The process of getting back to, let's say, 100% of where you were prior to contracting COVID-19 is for some people a lengthy one. Can you speak on something like that for us, Doc? Explain that to us.
Well, as I mentioned in the before, majority of the people are going to have a mild condition of no symptoms. That's probably are the more the people that essentially they are walking and with no major compromise. Now, if someone has developed the condition mild to moderate, they say that probably in average the time of recovery is 2 weeks. You need to have in consideration that probably some people, before they tested positive during the incubation period, they probably will have no symptoms, and the condition is being incubated without you don't know.
Yeah.
You've been tested. I mean that this is the mild to moderate cases. However, the moderate to severe cases, the recovery length on time, it will depend on several factors. One, what is your medical background?
Yeah.
What your age, and also it will depend on if you essentially were very, very sick, but you are not needed on mechanical ventilation and no admission to the ICU, but also the patient that are admitted to the ICU and ended on mechanical ventilation, then there are some additional factors that we need to take in consideration. And an average of people that they don't need to be on an ICU, but they are critically ill and no need for mechanical ventilation, they will probably have an average of recovery time of 6 weeks. However, if you end in the ICU and taking in consideration that if you are on mechanical ventilation, the length of time on mechanical ventilation, it will vary from 10 days up to 30 days. And in Peru report a case that they have a patient for more or less 60 to 90 days.
Wow.
I mean that you need to have in mind that in those cases, we need to have other factors involved. One, you be very polymedicated. You will use several medications. You will be under induced medical coma with sedation, with muscle relaxants. You also be on several other medications that we call it a supportive measure in order to keep the patients alive and also improve his survival possibilities. And then we are now talking about post-ICU syndrome. And then the post-ICU syndrome have independently if you have COVID-19 or not. If you are you spend that amount of time in ICU with essentially no contact, you will develop delirium. You will develop side effects related with the medication we are using. You can develop muscle weakness, lack of concentration. Some of the patients are essentially extremely weak that they are unable to return to the normal work activity, and sometimes that can be with people until probably 2 to 3 months or a little bit longer. However, yes, so just let me finish. However, in terms of the COVID-19 long-term recovery, is data that is not available as yet, because as we know, we are not even a year dealing with that condition. Sorry, go ahead.
No. Sorry, Doc. Doc, there are several things I would like you to comment on. One is, have we done an analysis to see what our surge capacity is? Because the chamber came out the other day with what they call cross-cutting confidence building measures for bringing stability to the business environment, and it's calling for the removal of subjectivity and arbitrariness in decision making, but it's calling for a numerical component that can be used as a gauge to see how we open, how do we handle, and etc. And how do we make decisions? So my first question to you would be, do we know what our surge capacity is?
Well, first of all, you need to define what is surge capacity.
Okay.
I mean, that's the first thing you need to know, because the people need to know and understand what those terms means. No? And surge capacity is essentially a measured representation of our ability to manage a sudden influx of patients. And that basically depends on how well functioning is the incident management system. You need to have an incident management system, and they, of course, need to be very functional and have, as you say, and different strategies to be able to measure. Because at this point, it's difficult for us to know what is going to happen when we open the airport. Of course, and as all of us know, we are going to, as far as we understand, the opening is going to be on a step-by-step basis, and I think so that's the best approach to do, because we cannot just not open the airport fully and then being next day or in a couple of days with a severe amount of cases. No?
Doc, but there are certain numbers that we can begin to see that come from abroad, that come from the world community, that in fact are showing in Belize. For example, of the closed cases, we've had about 300, I think, closed cases, a little over 300 closed cases, and 15 has died. That works out to about 5%. So of the cases that have recovered or closed, as they define as closed, we're following the international norms. So there are certain statistics that will begin to come out the longer this thing goes. Based on that, we can say to the Belizean people, look, we still have about 900 cases that are still active. If 5% of them are going to die, we can expect that 45 more people should die. Is that correct, Doc?
Yes, well, we have numbers, we have experience, as you know, the reopening of countries. You have several examples right now that, and we can mention a couple of them, and probably the best experience to reopening are from the South Korea and New Zealand. Probably they have the better experience into reopening. In our region, we have the reopening of countries like Costa Rica and Panama, and then they face their own problems. No, I mean there are several countries or several examples that we can follow, and we can and again, as you can see, even countries with more resources, they experienced different challenges in the reopening, and of course we need to know. And everybody knows the reality of our countries in terms of resources. I mean that there are many things, as you say, many ways how we can measure and we can estimate what is going to happen. And of course, we can, as I say, we can use as a tool the experience of our neighbor countries, as well as the experience of the most robust countries with more resources like New Zealand and South Korea.
So back to my original question, Doc, do you know if we have any idea of what our surge capacity is in this country, and are those numbers available?
I don't have the knowledge because I'm not working for the Ministry of Health. I just can, essentially as you, we just can basically comment on what surge capacity is, what are the variables that we need to have in mind in terms of what are the supplies or capacity of response, things that we need to have in mind. What are our capacity response in terms of laboratory testing, traceability, what are the resources in our different hospitals to respond to a surge of cases that requires ICU management. I mean, there are many questions that need to be answered. But again, unfortunately, I don't have those numbers with me. No?
Well, one of the reasons, Doc, I mean, the whole line was that we have resources in the private sector that are not being used, we believe. And we're saying, look, why not begin to, when you establish what the surge capacity of the public system is, then perhaps you can get some help from the private sector. In other words, maybe private sector should begin to do testing. Maybe private sector can begin to relieve the constraints, some of the constraints that we have in the public sector, because as you rightly said, we know that we have limited capacity in the public sector. Doc, what are your views on that?
I totally agree. This is again, this is a problem that is not basically one group problem. No, we need to work as a community. We need to work in cooperation, because it's a problem that affects us, all of us. It's not affects only one sector of the population. I mean that if we want to move forward, if we want to essentially trying to offer the best we can, then as you say, we need to work in cooperation between private sector and the public sector. And I think so. This is an option. This is a reasonable point of view, and hopefully that this type of cooperation starts. Especially right now, as you say, we need to know our limitation, and the most resources we can get, and the more people we can get involved, is going to be best for our population.
Yeah,
Doc, let's get your take on the shift from PCR testing to the antigen test. The fact that that is coming on board along with the opening of the airport on October 1st. Let's get your perspective on that.
Well, as you know, when we are using a rapid test, that is something that at the very beginning we say the sensitivity and specificity are not the same like the PCR. However, lately we have, as we know, there are more than 160 commercial brands of testing around available. No? And most of them, essentially, they was approved as an emergency, meaning that a good amount of tests we don't have, it's not been proven completely. No? Now, when it comes to the rapid test for countries like us, it's based on the World Health Organization listing of different kind of companies that been proved in the past that they are reliable. Meaning that when we are trying to use a rapid test, then the Central Medical Lab in Belize, they run, like we call it, a validity, and they've been doing that. I mean that they are using this test not randomly. They are using this test. They already run some validation, and we know that now that we are able to use it with the information they already have. Mean that that is something that we can use to be able to have more rapid response. As we mentioned, the PCR testing is a very, very labor test. It's not something that we drop some blood in a cast and it's a magic test that we have the report immediately. You know, the PCR test it essentially have several steps, and it usually takes 24 to 48 hours to be able to have the report as early. Of course, there are some technologies of PCR testing available in the US that they are offer the report in a shorter period of time. But again, this technology that is still granted approval, and some of these tests also they are not allowed to be sold out of the United States.
Yeah.
Doc, would you agree that testing is something that we need to pursue more aggressively in our country? It seems to me that the protocol now is that we only test people with symptoms, based especially on what we've been hearing from many persons, persons in San Pedro, all over the country. It's difficult to request a test. So again, Doc, we thought that the private sector could play a role here for those people that can afford to seek their own tests, to relieve the government services of that burden. Doc, so would you agree that there are reliable tests available, and can the private sector play a role in helping to relieve government of that sole responsibility?
Yes, of course, we need to understand a couple of things. One, that the PCR machines, if you would say, okay, I want to buy a PCR machine because I already have authorization for the government to run the test, then I place my order. And sometimes these orders can take between 2 to 3 months to have the machine in country. And then the kits that they are selling to you is based on quotes. You are not able to order 1 million of kits if you want, because they are not going to sell you. They will give you certain amount of kits, depends on the size of the country, for the more reliable equipment. Of course, that, as you know, there are several other things that you can buy, but the reliable equipments are very difficult to get, and the kits are based on quotes. I mean that it's not as simple as that.
Okay. Wait. What about this new test that we hear coming out of Israel, Doc? Have you heard about that one and your views on it?
What is exactly the test? There are many tests. As I tell you, it's 160,
Yeah.
More than 160 different tests.
The test I'm referring to is that they came out with one now that you gargle basically, and that's the impression I get.
So instead of being swabbed,
Yeah,
you're saying that the individual
gargle.
would gargle.
There are many tests available, and it's not only in Israel. It's already in the United States that there are many tests. They are trying saliva. They are trying also a stool test. I mean, there are many things that essentially they are promoting that could be more simple. Like the saliva test is something that is going to be more simple, because of course, I don't know if you already did the swab test, but to be swabbed is very uncomfortable. I mean that, but of course, more important than anything is we need to see a test that could be simple, but also with a great sensitivity and specificity, and as well as most important than anything is the affordable as well. No, I mean that those things are very difficult. But again, there are, as you say, there are many tests using tears, saliva, stool, urine that are being tested as we are speaking. There are in terms of testing, there are of course more than 160 that are granted an emergency approval. Some of them are reliable. Some of them we still need to know. In terms of medications, if you go to the clinical trials website, there are medication testing, pain control, nutrition, all the overall management and support for COVID-19. As we are speaking right now, if you go to the clinical trials website, there are 3,237 clinical trials ongoing.
Wow.
For those, some of them are recruiting, some of them are not recruiting, some of them are enrolled patients by invitation. Some of those trials were already suspended because of risk for population. Some of them are terminated, some of them are completed, and some of them essentially are being withdrawn. I mean that just to give you an idea about the amount of information, we get a lot of information every day, but can you imagine 3,237 clinical trials, pieces of information that we are going to get in the following days, months, and still, no? And of course, one of the important aspects and probably we are appealing is the vaccines.
Yeah. But Doc, I mean, I guess the point I'm trying to make and I'm trying to get you to agree with is that there is ample opportunity for the private sector to become involved and to relieve the government or to strengthen the government and to lend to increasing our capacity to deal with this pandemic. Would you
I
agree with
cannot agree more than what you say. Essentially, that is completely true. We need to work in cooperation, private and public. It's time of cooperation. It's time to all of us, all different players, get together and move forward for the best of the country. You know, and it's a huge opportunity of cooperation that is there. And that the government, I believe, they need to grab on it to, as you say, just to release a little bit the burden that they are having, and also to that, as you say, an option for those that can afford that if they can go to a private facility. I totally agree with you. We need to cooperate. We need to work together. We are all of us in this together. It's not the fight of a single person. We need to be. It's a fight of all of us.
Well said, Doc. Well said. That brings us to the end of this conversation. Is there any other information you want to share with us as a parting shot?
Well, probably the most important information is concerning vaccines. At this stage, we have 4 promising vaccines. We have different laboratories. We have Moderna, who have essentially a vaccine that is going to be applied to vaccinations 20 days apart. They already present his phase 1 report in July 14, and we already on phase 3 of the clinical trial. That means that they are involving 1,000 people on different ages, as well as ethnicity groups, to have the most of the results. Of course, the different regulatory organizations granted these studies and clinical trials a reasonable amount of numbers, enough to provide certain security for us that these vaccines are going to be reasonable. In terms of efficacy and durability, is something that is very difficult to predict because of the time. We have also the other vaccine from Pfizer, BioNTech, and Fosun Pharma that also they present phase 1 and phase 2 results in July. And the FDA approved a fast-track status for these companies to try to be able to produce, go to the phase 3 study and trying to see if by the end of the year we have already some of the vaccines. And then we have the AstraZeneca and Oxford that also they went to phase 1 and 2. They already presented the results. And then they are also in phase 3 with the promise that they will have an emergency vaccine supply by the end of October. They're supposed to produce 2 billion of dosages for this AstraZeneca vaccine, the Oxford one. And we have the other vaccine that was approved by the CanSino Bio in China that essentially were approved in June essentially to be used by the military personnel in China. I mean that that is the horse race we have right now, to have a vaccine available. As you know, the overall treatment for the critical ill patient is still supportive. There's still many medications that are offering and promise the best. Some of them are already out of the protocols because they prove that they are not beneficial, and also there are no improved mortality in this type of patients. meaning that essentially for the critical ill patients, the medications are limited, and essentially the treatment is based on the support. No? Meaning that hopefully those vaccines, so far the vaccines are, with the information we got, are presented with a mild side effects that essentially some of them have fever, some others have essentially muscle ache, and some others have insomnia as the major side effects. I mean that is promising. We'll see what happens. No?
All right. Thank you, Doc.
Thank you,
With
Doc.
that, we go to our commercial break. And when we return, it's to have a discussion and update on the advocacy and support in respect of the banning of gill nets. Stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.